All right, everybody, welcome back to the show. On this episode, we have a very special guest, Susan Steitz. Susan, how you doing today, ma'am?
I'm doing great. Good to see you, Rich.
Yes, likewise. Susan, for those of us that don't know anything about you, can you please tell us a little bit about yourself and how you help people, please?
Of course. So I am a psychiatric nurse practitioner. I'm also a family nurse practitioner. I've been in practice for 12 years, and my focus is on helping people with their mental health so that they can live their best life.
Oh, that is awesome. Susan, who do you help most in your practice?
So, what I see most commonly is people who have anxiety. A lot of times that's coupled with depression. I also see treatment resistant depression. So, those are people who have tried many different things, a lot of times by the primary care, and they need further treatment. I see ADHD and insomnia and a lot of mood disorders.
Gotcha. And who would you say your demographic looks like? You see kids, teenagers, adults, men, women? How does that kind of play itself out?
Yeah. So I do see male, female, and am able to treat across the lifespan. So that means I can do children down to age 8, adolescents, and then into adulthood.
Awesome. And Susan, how do you know that you are a good fit for the client and that the client is a good fit for you?
So that's a great question. So right before I got on the call with you, I was meeting a new patient and he was kind of basically interviewing providers and he wanted to know what would make me stand out, what kind of care would he receive from me. And what I discussed with him is that something that patients have appreciated in having that relationship with me over the last 12 years is that I actually really do care. And I will take the time to listen to get things right. And he had had an experience with the previous provider, his last provider, where he just felt that he wasn't listened to, just really treated more like a number because they're in a hurry. And that's why I have my own practice so that I can take the time to get things right, even if it takes extra time, because this is a person, this is a human being, and we all want someone, who's helping us to care. So,
Yeah, that's awesome, Susan. And I appreciate that you said that because it's true. A lot of providers are in a rush. They're squeezing in patients or clients 5, 10, 15 minutes, and to find somebody that genuinely cares,
yeah,
to really slow down and listen and understand and be present with the client really is a competitive advantage, I think. So thank you for sharing that. I really appreciate
of
that.
course. Of course.
Susan, so let's say somebody's a good fit and then they show up for the first session. What does the first session look like?
So the first session is going to be where I have already had the patient complete some different questionnaires to help me understand why are they being seen, what is their main concern. They're doing different assessments so that if there is something there that maybe hasn't been realized in the past, it basically gives me a heads up on what's going on, areas that need to be probed further. So that's a 1 hour initial appointment. There are sometimes where I may be making a new diagnosis, or I may be addressing a diagnosis that's already there, but maybe not getting, they may need additional treatment or something better that would help alleviate their symptoms. That's basically what the focus is at the initial visit.
All right, Susan. So somebody shows up and they do the first session and everything works out well. What does progress look like when they work with you?
So, progress is where patients' symptoms are alleviated, where they have improvement to where they can say, okay, now let's say it's someone with depression. So my mood has been lifted. I'm able to function better in the different roles that I'm involved in my life, whether it's at work, whether it's home, whether it's school. Their symptoms have been improved, and we're looking really for a significant, as much as possible, improvement so people can live their best lives.
Oh, that's great. And Susan, there's some providers out there who may be a little more direct, others who are kind of more humorous, maybe laid back. I like to ask, how would you describe your style?
Well, my style is one of understanding what the patient is looking for. And so, in that, what I mean is that if the patient is looking for a therapeutic relationship, they found the right person. I'm the one who really has a great understanding of providing compassionate care. So I'm really going to listen to the patient, and then just really focus on building a therapeutic relationship, because I want the person to feel comfortable, that I'm someone that's a support to them, and somebody who they've been able to build a relationship with, and someone they can trust.
Got it. Now, Susan, if somebody is having some challenges with their medication for whatever reason, how do you what's the protocol to adjust that medication?
So when I start someone on a medication, sometimes we may not need to make a change to another medication. We need to get to a therapeutic level, a therapeutic dose of that current prescription. So what we don't want to do is make quick changes from one agent to another. They may not have derived benefits. So what we would do is just increase that dose, typically, as long as there were no negative side effects occurring, because we may needed to have just gone a little higher on that agent in order to get the patient the relief that we're trying to acquire.
Got it. That makes a lot of sense. And Susan, a lot of times, the spouses or the family members of the patient may show up to your office. Do you provide them education as well to kind of help them understand what their loved one is going to be experiencing, maybe?
As long as the client is open for, if the family member or friend or whoever their support person is, then they're always welcome to be present. We just have to have the permission of the client.
Yeah, thank you for that, Susan. As we know, progress isn't linear. Sometimes it can be one step forward, two steps back. How do you prepare your clients for that?
So there's no cookie cutter way to address the symptoms in order to derive improvement of those symptoms. Really, just looking at it from each individual patient, and helping them understand that progress can be made. Sometimes changes do need to occur, but we're going to work together to get the best end results, again, so that the patient is able to live their best life. Because if we've got our mental health doing well, our physical health, doing well, we really are able to live the best life and most fulfilling life that we can.
Gotcha. Yeah, that makes a lot of sense. Susan, how do you know when a patient is ready to be done with their work with you?
Yeah, that's a great question. So I really try to take a collaborative approach with the patient. I'm working with them. It's not me just telling them this is what we're going to do, but I'm really partnering with them to bring them the best end result. And most people's goal when they start a medication is not to stay on that medication forever. For some people, it is needed. They're open to that. For others, they want something that's just going to help get things stable. And then they want to, taper off and try to be without. So really, that's really a patient-led approach. So I definitely want to focus on what is the goal of the client. What is the goal that the patient is trying to achieve? And then I work with them to help achieve that goal.
Yeah, thank you for sharing that, Susan. If there's a client who's maybe resistant, if that's an appropriate word, or maybe reluctant to take medication, are there other options that you help them lean into?
Well, I'm definitely going to educate the patient on many different aspects. So I certainly will discuss how, the difference that the medication would have on their symptoms, especially because we're looking at evidence-based treatment. But I always approach things from a holistic perspective. So we want to look at lab work. We want to look at therapy. We want to look at medications, and what would be the right dose of the medication to get the patient the result that they're trying to achieve.
Susan, yeah, that's really awesome. And thank you for sharing. Are you trained in any other specific modality or approach that can help improve client outcomes?
Yes. Yes. So I do have some training in cognitive behavioral therapy to help patients myself along with medication. But I actually have a part of psychiatry called integrative psychiatry. And that is where we actually utilize natural supplements to enhance the effect of a medication or to reduce the need for a medication. So I do have training in that, just the use of literally natural supplements applying to the patient's symptoms.
Wow, that's really awesome. Susan, yeah, thank you for that. What has been the feedback from the clients about their experience working with you?
I would say the biggest feedback that people give, that they've given to past employers and to myself, is that they don't want to see anyone else. They really know that I care, and then again, I just take the time to listen, and just really value building a rapport and a relationship with a patient. And the feedback that I get is they don't want to see another provider; they want to see me.
That's awesome. And I think that feedback is really a testament to the quality of service that you provide. And so kudos to you, Susan,
For sure.
for receiving that kind of feedback. I'd like to
Yeah.
switch gears a little bit and ask a little bit about you. Is that okay?
Of course. Sure.
Awesome. So what motivated you to pursue this line of work in the first place?
Well, to be honest, when I had my second child, I was in the hospital. I was on the labor and delivery unit, and I just watched each of the nurses, and I watched how much they enjoyed what they were doing. They tried to meet every need that I had, and I thought, that is what I love to do. I love to help people. I love to improve people's lives. I love to make them feel valued. And when I saw that and I received that care myself, I said, that's the work that I want to do. This is where I need to be. And over the last, really 16 years, I know that I've been in the right line of work because I have been able to use my medical expertise, but also my desire to make other people's lives better. It's just been the absolute best area of work that I could have gone into.
Wow. Yeah, that's incredible. Susan, how do you spend your time outside of the office?
I spend my time outside of the office caring for people, just in a different capacity. So, one of the biggest ways that I do that is I happen to be married, and we have a lot of children, some that are biological, and then some that we've adopted. And so they're probably take up the majority of my time. But I do enjoy doing extracurricular type of things like riding my bike, walking, going to the beach, going out to eat. There's a lot of foodies in my home, and they love to anywhere that we can go out to eat. So, that's basically what I spend my time doing when I'm not with
Oh,
patients.
yeah, it sounds like a lot of fun. Susan, what's on the horizon for your practice? Are you thinking about adding some staff members, maybe coming up with some coaching programs? What does that look like?
Well, what I'm looking at as one of my goals is, as I build my practice, bringing on other providers who share the same perspective as myself, and that is that each client is valuable, and we need to do our best to make their lives better. So that's really one of my biggest goals. Is as I expand, I can meeting the needs of patients and receiving referrals, that I would have enough clients to open it up to other providers, and provide them an opportunity to serve.
Yeah, that's awesome. Susan, how many are you seeing? Are you accepting new clients now?
Yes, I am, and we can get patients in very quickly, usually in about 24 to 48 hours.
Oh, that's great. Yeah,
Yeah,
because I've heard some horror stories by some people who've had to wait some time,
yeah,
and they end up like finding somebody else just because the wait is too long. And so,
yeah.
yeah, that's really cool that you can see people pretty quickly. If somebody wants to partner with you, Susan, they like your style, they're liking the way you present yourself, and they want to reach out, how can they do so?
Well, the easiest way is to either call my business number, or to reach my website, which is therapeuticpsychservices.com. My business number is 407-287-0874. And they can actually call that number or text that number.
Awesome. And we'll make sure we plug that into the show notes. Susan, I really appreciate you coming on the show today. This was really insightful for me.
Yeah.
And maybe we can do it again in the future. How does that sound?
I think that sounds great. And I thank you so much for having me and taking the time to find out about my practice and how I can help improve anyone's mental health.
Awesome. Yes. Thank you for that, Susan. All right, everybody. Thanks for logging on to the show today. Until the next one, signing out. Bye.